The big takeaways for me are to be thoughtful in where those connections exist in my life, and for me to really go down and figure out the root cause of these things, right? So if I'm feeling overwhelmed at work, or there's a lot of things going on, on the home front, is that the case? Maybe it is. Maybe there are a lot of stressors that I'm faced with, with the business between you and I, or the job, or the family. That for me is the big takeaway, to really don't just respond when I have this negativity. It happens to all of us. We all have negativity in our lives. It's just a part of life. If life's not meant to be easy, it's meant to be a challenge. It's meant to be an opportunity to grow. But if all I ever do is respond to those stressors, I may not truly understand what's the root cause and how can I attack them and get better so that I can stay on the path.
Welcome to the On the Path podcast, a conversation on navigating life. Join Chris Coker and Colin Chris as they have honest conversations with fellow travelers on the path. In each episode, they explore the physical, mental, and spiritual health aspects of the whole self, striving for personal accountability and a strong community. Gain insights, learn from our mistakes, and hear from guests who have mastered these areas. Step on the path, embracing every challenge and success along the way. See you on the path.
If you are just listening, this is one of those I would highly recommend going to our YouTube channel and watching, because as we said in the intro for Dr. Chris Frueh, we are doing it from Mr. Chris Coker's office, I think we would say.
Welcome to my home, Colin. You've dined with my family. You've gotten the tour. Welcome to Buffalo.
I also learned that you have multiple different impersonations that you're incredible at. I will leave it there, but
yes,
your kids are awesome. They adore you, and I'm very thankful for your wife allowing me to disrupt the family vibe for a few days.
And thanks for coming, man. It's no small feat. You already travel a lot with all the things you've got going on. So to have you fly out here and do this face to face, it's just it's awesome. It's great to see you.
I thought the best part was you messaged me like, "Do you want to see anything?" And I was like, "No, I can't. I don't think of anything that I'd want to see here." And then the Uber driver, I was tired. It was super late, and he was throwing out some good ideas. And then he's like, "Have you seen Niagara Falls before?" And I was like, "Yeah, that actually is something I really actually want to see." And I totally didn't remember that it is right here. So
yes. And don't worry, we will not do Colin a disservice. We're taking him to Niagara Falls tomorrow to go and see the sights.
Supposedly. I'll believe it when I see it.
I might wear this.
Yeah,
again.
that's
actually,
the point I want to bring up too. So you came, pick me up from the hotel this morning, and you just mentioned, my daughter wants to ride along, but you forgot to mention, I'm going to dress extremely well today. As I came out, we're recording episodes live. I knew that, but then I walk out and I see a collared shirt. I get in the car. We did not talk about this. You didn't give me any sort of heads up. So I look like a scrub, and you look like
fantastic.
You're about to go to the club or something. I don't know what's happening.
The dichotomy of co-hosts. Yeah. That was the spirit we're channeling for all of you. So, by all means, hit us up on Instagram and let us know if you're more of a t-shirt and snapback type or a button-down type.
Oh, that's what we're doing here? Because I'm actually just after this going to go text YL and bring up to a conversation we didn't record about how you don't just wear your snapbacks every time. So the hat on backwards, if you're not familiar with the snapback term, but I never took so many. Okay, so getting serious now.
All right, let's dive in.
You can switch to the audio portion if you want to go back to Spotify or Apple Podcasts or whatever you listen to, because that's done. Thanks again, Chris. All the sarcasm. Getting serious. Dr. Chris Frueh.
That's right.
Debrief. I've never taken so many notes in my entire life in a podcast.
Deep clinical expert.
Yeah.
Chris Frueh is a deep clinical expert. And so today we're going to go deep as to the best of our abilities in trying to unpack some of what he talked about. But again, Dr. Chris Frueh is a clinical psychologist. He's a professor at the University of Hawaii Hilo. He's got 30 years of experience in adult psychopathology. We do not. We're a couple of business guys who happen to be in the military at one point, and this is going to be our rendition of what he laid out. So I will say, if you want to go deeper into the true technical terminology, go to his website, chrisfrueh.com. His last name is Frueh. So Chris drfree.com, and you can pick up his book Operator Syndrome and read it there. You can also see a lot of different blogs that he's done, go through some of his publications, and hear it directly from him if you want to learn more about some of the technicalities of what he talked about in this episode.
I think there's also something else you can find on there. Remember, your favorite part are the fiction
Yes,
novels.
you can also go purchase all of his historical crime fiction novels. He has several.
Okay, I just couldn't let you forget about that part. I'm now sitting in front of your bookshelf, and it's not all self-development books. It's actually primarily some sort of fiction and yes. Yeah. Well, we'll talk about that in another episode, maybe the next map check.
Yeah.
But
one of the things we wanted to highlight too, by the way, because Colin, you and I were talking about this before. One of the most exciting pieces with this conversation we had with Chris is he's the first guest to date that we didn't know prior to launching On the Path podcast. And as we were talking about it, it really is this testament that On the Path is building community. It really is, he had an opportunity to hear the show, and he was interested in coming on and sharing his wisdom and imparting some of his learnings with you all as our audience. So this was a really special episode because this was the first time where we were able to establish a new relationship through the conversations that we're having on the show.
I thought it was such a cool experience at that point too, because for the guests we've had on to date prior to Dr. Chris Frueh, we had some sort of relationship with them, whether it's we worked with them, they were our therapist in my case. And then it was a great way to meet also different people that had a big impact in our life. And we're going to continue to do that. But this was so cool to actually have somebody that can see the products we've put out there to date, things that we've been learning and how we've been applying them to ourselves. But then, think that we have a platform that they would feel comfortable coming on to. And it meant a lot. So thank you, Dr. Chris. It was impactful in a very unique way. I thought it was such a cool next step. And it's going to be exciting to see who we don't know that can come on and continue to help us grow as we're on this journey on the path.
Yeah, absolutely. So with that, let's start diving into some of the learnings that we had, some of the things that we really want to unpack here. I think we ought to start with operator syndrome. He really, in the episode, he'll go very deep on the structure of the book and the things he talks about. One of the things that I really liked that he said is, I'm going to look at it because I want to make sure I say it right. Operator syndrome is a framework, not a diagnosis, which I thought was really interesting. So why don't you help us? What were some of the takeaways from that section of the episode?
I think we really were thinking about it from two different standpoints. One's those impacts on the body, and then the mental aspects of things when it comes to operator syndrome. For the body aspect, he mentioned concussions, hormones, which could be affected by TBIs, sleep disturbance, chronic pain, injuries or other things that have continued to grow. But also there's the mental aspects as well. We were talking about anger, anxiety, depression, and we'll go further into that piece. But it was this framework. Once he really broke it down for us, you can see, everything really does add up. Everything can play a role in the other aspect of things. If you are working on and going to therapy, working through depression, anger, anxiety, whatever it may be, you're going to therapy for childhood trauma, that you could be making great progress, but still feel bad or still have some of those other aspects. And so it really is this holistic framework that they do all play into each other.
Yeah, and that was something that we hit on in the Dr. Britt episode, the interconnectedness, right? And so Chris actually, he was talking about the whole self with us and how these things are connected. So I think the term that he used was chronic systemic inflammation. So basically these mental ailments that these operators or these first responders experienced in his book, that manifested itself in a physiological way, that there is a direct connection to the mental stressors that they were under and the chronic inflammation that their body would experience. And that was something that Dr. Britt had pulled through for us as well. Yeah,
it just goes to show that it might not be a one-stop shop if you're, seeking professional help to work on or to address something going on in your life. And I know that seems overwhelming at times too, but I think that for us, especially when we were developing the whole self-philosophy, we had realized it wasn't just one thing. It was, these multiple things we had to put together to stay on the path and work towards our purpose or living an intentional life.
Yeah.
What else with the operator syndrome? I mean, when you think about it, this framework, he really addressed so many different areas within the framework. It's hard to say is there one that's more important than the other? It seemed like it really is holistic. It's not, this is the one thing. And if you fix that one thing, sleep disturbance, then everything's going to be great too.
Right. Which, and for everybody listening, for everybody watching, that's an important point for you in your life, no matter the walk of life that you come from, but you have to look at this holistically. That's why the whole self philosophy is what it is. When we talk about it on the show, it's very much about how is your mental state? How is your emotional state? How is your physical state? And one of the pieces that we had, we asked Dr. Frueh to pull through, what's a technique that we all could leverage to try to combat some of this. And one of the things that he had mentioned was an anti-inflammatory lifestyle, right? So think about, you guys, you'll hear it on the internet or from some of the experts that you follow. There are foods that you can eat that will cause inflammation in your body. The same way that certain mental stresses or emotional stresses will inflict that same kind of inflammation. So Chris's advice for us on the call was very much like, think of that full picture and how can you live an anti-inflammatory lifestyle? How can you focus on the things that you're eating, getting good sleep, and all of these different components of our lives?
He also brought up cold plunge and sauna.
Yes,
and when he said cold plunge, there was, a lot. I felt a sense of loss because I don't have access to a cold plunge right now in my current lifestyle, but you've gotten to see the one that I built last year, which I've since donated to a friend, and he's upgraded and continues to be in use. But it sucks. At the same time, it was, for me, I knew there was physical benefits, but at the same time, I was also thinking about from the mental benefits for myself and just doing a very hard thing every day at the start of the day, usually.
Yeah. So let me ask you, Colin, real quick. So obviously everybody knows at this point, at least for this half of the world, you're a very well-traveled individual at this point. Obviously you
made it this far north. It wasn't the Oregon Trail, but it felt that way getting up here.
Basically Canada is where we are. Well, how do you still get some of those benefits? Obviously your cold plunge didn't fit in a suitcase, but how are you, getting, are you getting that in your life? Are you getting cold exposure? Are you thinking through some of these? What are you doing now?
I think for me, especially talking to Dr. Britt, because I always was aiming for like some sort of perfection. Like I need to hit these things every day. That's where I was really great working with her. Is it's always a balance, right? So maybe I'm not able to lean into some of those things as heavily right now, but cold showers are pretty much always available. You can also see, especially here, I'm sure in the winter, it can be next level cold showers.
Oh yeah.
I think you just have to find ways to adapt. Okay, this isn't available to me. What is the next best thing?
Yeah.
And sometimes I miss it. And sometimes I'm like, I can't, I just don't have it right now. It's unavailable to me. Oh, well. But I know I'll have to go back to it one day. And so it's hiding there in the closet. It's going to come for me one day.
No, absolutely. Absolutely. So, all right. So operator syndrome, all of these different mental, emotional, psychological impacts that can have, the connection onto the physical piece of our bodies as well. So what's the risk there? He kind of unpacked that a little bit with us. If we don't do these things well, he talked about some of the risks that we're faced with. Let's dig into that.
I mean, I think when you talk about the risk, he was talking about how these things compound on top of each other, and it can lead to impairments later in life. And some of those may be unavoidable when you think about physical injuries in your body, whether you're breaking your legs in a base jumping accident in the northern Italy. I don't know who that would be applying to, but it hurts. But I did think it was interesting to talk about how they can compound on themselves. And so we did address a little bit like, maybe it's too late, or like, what can you do now? And that's where the anti-inflammatory lifestyle really came up, which impacts so much. One thing that he said kind of within all of that was how important purpose is. And that's something we've talked about very lightly on this show, because we've created the whole self-philosophy, physical, mental, spiritual, personal accountability, a strong community. But we've never really talked too much about purpose or living, intentionally. And that we do believe is still very unique. But he talked about how important it was to really know your purpose, especially if you're in the military, you get out, you've lost such a big sense of purpose. That can also really inhibit things and make it hard no matter what you're doing perfectly.
Yeah. Yeah. And one of the things, Colin, you and I have talked about this, ad nauseum, like this idea of, knowing your purpose. That's not an easy thing to do. And I think it gets it gets blown up into this big, huge, impossible question to answer. And one of the things we were talking about actually before we hit record on this debrief was there's a way to chunk it down. Like, it's not like you say, oh, this is my purpose in life, and it stays static for the entirety of your life. Like, it changes over time. And I think one of the things we talked about is just the importance of taking a pause and asking yourself today, like, what's my purpose today? Like, what is it? And just to go through that routine exercise of simply reflecting and trying to live purposefully. And I think focused on that, it makes it much easier to do, to actually stop and think like, am I living purposefully today? Okay, I feel like I am. Well, how? Let's unpack that a little bit. And that helps us get to the root of what our purpose is.
I think you could take all that time, right? Write out the perfect purpose mission statement for yourself.
Yeah.
But if you're not reflecting on it every day, you're not also thinking of what is that little thing I'm doing today to help me live into my purpose. It's a great exercise, but it's hard to actually pull those things through. And I like that. Sometimes maybe your purpose for the day is I just need to make sure I take the trash out, clean the house because of XYZ, or I need to, hey, I was kind of, I was really busy the past few weeks. Maybe I can take some time to spend with my kids or my wife.
Yeah.
I'm speaking for you. I think for me,
no, absolutely. That's exactly right.
I'm going to go get a new Lego set and I'm going to relax this weekend. Different phases of life. And I think everybody's purpose is unique to them.
Yes.
And so the fact that he hit on it, and it was such an important aspect of things, was really impactful, because we know it's important. We just know that we can't tell anybody what their purpose is. So we don't talk about it as much on the podcast because we can't tell anybody what their purpose is. It wouldn't be right for us to do so.
Yeah. Yeah. Now, one piece I will, and I'll credit you with this, Colin, because I didn't really do it until you and I started talking about it a little bit. But one of the ways that I think, getting better in my own life about thinking about what my purpose is actually through journaling. I journal. I try my best to do it daily, and I'm only human. I don't hit it every day, but
I'm
do.
On week 2 or 3 of.
Yeah. But it's good to do this because like the way I use a protocol where I'll just put down, like, what are the things I'm grateful for? What am I striving to achieve today? What's something that might get in my way of achieving what I'm setting out to do? And it's a good way for me to hit on these small micro purposes. And what I'm finding is over time, I can start to see these common threads in the different journal entries I'm doing where, a lot of my, micro purposes are focused towards my family, or focused towards, the mission we're seeking to accomplish here on the path, or in my work life, or as a dad, or as a friend. So for everybody listening, for everybody watching, that's one way we can, as Colin said, we can't help you figure out what your purpose is. But what we can offer you is some tools that you could leverage. So if you're not good at sitting down and just reflecting and taking a moment to just like silence your mind and think about it, write it down. Like, I have a very busy mind. And for me, I find that writing it down into the written word and being able to read that back to myself is a really good way for me to go through this exercise of seeking what my purpose is that day. And it helps me unpack kind of the broader question of, well, what is my purpose in life, Yeah,
I couldn't agree more. And I think maybe you can take the credit for the journaling part, but you actually gave me some of those key things to hit every day.
Yeah.
So I think it was at the end of last year. And it was really great to also have that framework, because maybe I think for me, I need to do it in the morning. And sometimes that brain's not firing on all cylinders. And so having that framework is also really helpful. But starting with gratitude every day has been, just a game changer. Whether you're still figuring out your purpose or not, what can you be grateful for? And I think sometimes it's so basic for me. It's like the plants are super beautiful today. I'm so grateful for that.
Yeah.
And it may seem, I don't think it has to be anything profound sometimes too, just what comes to mind and what are you thankful for? But with that too, I know he mentioned, and he talked about therapy. He talked about having, you're going in there, you have to work through things, but at the same time, what are you working towards, and having more of an action-oriented therapy plan. And that's where I have to credit Dr. Britt, my therapist, who was on the podcast, for doing all those things. But she spent a lot of time on purpose with me and actually making me do different exercises to really get to that clarity of what is my purpose in life right now. And obviously, to your point, it's not stagnant. It can change. It can change in a heartbeat. It can change over time, depending on what phase of life you're in. But that was enlightening, but also credit that I was fortunate enough to have a great therapist like that, but also the importance of you might not have the first and best therapist every time too. So I think of therapy like dating. And so sometimes there's just not that right connection, or you guys aren't talking the same language as far as, what you need or maybe what they have to offer. And sometimes it takes a few different times, is what I've found, to find the right therapist that works for you, that also maybe understands you best. I think great therapists, they don't have an ego, and they may also know, hey, we've reached the maximum of my capability. And that's not a slight. It's just, you want to find that best thing for yourself too. And so it's great having an honest therapist. It's going to help you on your path.
So let me ask you a question, Colin, because one of the comments that Chris Frueh made on the episode was, in the context of therapy, there's talking and there's doing, which I know is something you're alluding to it right now. And this is something that you've talked about with Dr. Britt as well. But like, where does that take you? This idea of therapy talking versus doing, why is that such a critically important component of therapy?
I think it's tricky. Let me say that right up front. I can only speak for my experience, but I also could see for myself is, if I was ultimately just grave digging is what we've called it before, but just trying to, what's the problem? Where's the problem? What is the problem? I think there's a lot that needs to be done there. But at the same time, if you're just stuck in that place, then all you're doing is thinking and talking about your problems. And so that's where I have to credit, from what I recall, my experiences with Dr. Britt was, it is some of those things, right? Maybe it's understanding, certain behaviors you have now, and how did you pick those up along the way? But at the same time, that North Star of, where do I want to be in 10 years? What is my purpose? How are my behaviors or actions that I know are, I'm suffering from? How do I impact others around me? Because it's not always just about, me and my problems. It's also, how are those impacting positively or negatively others too? Yeah. And what are they dealing with? Sometimes it's not, I don't think anything's ever that black and white too, along the healing journey. And it's hard work, but that's also part of the whole thing that he's talking about, is you've got to have some sort of, action oriented, or it's about the doing part of things too. And it's tricky. That's why I say it's tricky, because it can seem overwhelming at times for people. It can seem like maybe I'll always feel this way, but that's also where it went back to operator syndrome, is sometimes maybe feeling bad isn't just a mental aspect of things. Maybe it's this damage or abuse your body and has taken over a period of time. Yeah.
And this is where the whole self philosophy, I think, really complements that, because this idea of personal accountability and strong community, right? You have to take it upon yourself to say, okay, I need to be action oriented in my healing process and in my personal growth and these things that I'm seeking to accomplish. But then there's also this idea of community. You have to really, really be judicious about the people that you're bringing. They have to complement the community, right? They have to make you better. And if they're not, you have to be pretty strenuous in making sure that people like that don't stay in your life, right? You'd mentioned like therapy is a little bit like dating. You have to make sure that it's a good fit for you. Yeah. So it's this personal accountability piece to remain action oriented, the doing, not the talking, coupled with a strong community, making sure that the people in your corner really are in your corner.
I think if you go just one layer deeper, especially on the personal accountability part, there is a balance. Sometimes it's not always this, I need to get something done. It might be, I need to give myself some grace today. And I can acknowledge that, where I may not just be doing great. I might be in a really bad place. That's where having a strong community is also great, because if you trust the individuals in your life, maybe you can say, hey, I'm doing all this work, XYZ, but I'm also just having a really crappy day. And that's where a strong community can be great, because they can help be there for you during those times, because they know you want to get better, but at the same time, they also know it's not ever a journey we can always take on by ourselves too.
Yeah, absolutely. So the really the last one that I want to hit on from the episode with Chris, he used this phrase that I really liked, the vicious versus virtuous cycles. This idea of, you can fall into that wheel of bad decisions, right? Whether it's, or the detriments in your life on the mental side, and how, that depression or some of those things that you're dealing with, if they go unchecked, they can negatively impact the physical side of your health. Right. And then the physical side, if you let yourself, slip into bad eating decisions or bad drinking choices, that then impacts your mental side, the vicious cycle. Right. And then he also talked about the antithesis of that, these virtuous cycles, that there is, if you are action oriented and you are focused on, the mental and the emotional growth and health, you couple that with, good physical choices, the things that you're putting in your body, and then you find yourself in this virtuous cycle. Right. So that to me was one that it just kind of stuck. That I think, like, what are the choices I'm making? The small habits I'm making in my life, are they lending themselves to a virtuous cycle or a vicious cycle?
I think with that too, there's so much within each of our elements of the whole self philosophy that we can really dive into. Because when we think physical, you and I, we're not just talking about going to the gym or going to classes or group workouts. It's also what am I eating? How's my diet or the other aspects? How am I treating my, sleep is a huge one. And I slept really good last night, in case you were wondering.
I slept in a little bit.
Which was authorized. We didn't have a set start time today, just to clarify. Some of us haven't missed our, agreed upon gym times before when we've met up. That was me throwing shade. I apologize. You didn't deserve that. You look great today.
That's all right. Thank you.
But I think with that too, I imagine I'd love to hear, as we're closing it out today for operator syndrome, when you think about our whole self philosophy too, are there different elements within our 5 different elements? There's 5 different parts that speak to you, or maybe the depth that really, you can take away from the operator syndrome and pull into your own life.
Yeah, for sure. One of them, and again, you mentioned Dr. Britt a few times, it harkens back to that episode with her. We talked about the interconnectedness of these different types of strength. And that became abundantly clear for me in the conversation we had with Dr. Chris Frueh, that these things are interconnected. And so the big takeaways for me are to be thoughtful in where those connections exist in my life. And for me to really go down and figure out the root cause of these things, right? So if I'm feeling overwhelmed at work, or there's a lot of things going on, on the home front, is that the case? Maybe it is. Maybe there are a lot of stressors that I'm faced with, with the business between you and I, or the job, or the family, or maybe I'm just kind of sleep deprived because there's a new Netflix series that I'm watching late at night and I'm not sleeping well, right? Maybe that's really the root cause. And if I focus on that, the stressors on the other side of my life will fix themselves, right? Or vice versa, right? So I think that for me is the big takeaway, to really don't just respond when I have this negativity. It happens to all of us. We all have negativity in our lives. It's just a part of life. If life's not meant to be easy, it's meant to be a challenge. It's meant to be an opportunity to grow. But if all I ever do is respond to those stressors, I may not truly understand what's the root cause and how can I attack them and get better so that I can stay on the path. So for me, that's the big one, is when these things crop up, to acknowledge that there's probably more than one element at play, and to take a quick pause and ask myself, what are those different elements, so that I can really focus on addressing the one that matters most in that moment.
And it goes back to what you were saying about those honest conversations every day. How can you live into your purpose in even just micro ways, or what is my purpose for the day too? And some of that definitely involves, I think, what am I going to do for myself when it comes to helping me make myself better so I can show up better for others. And I think there's a lot more we can learn about operator syndrome, but more so those different aspects of what can impact your total health and living an anti-inflammatory lifestyle, which makes me think I probably shouldn't have had all those donuts that I had this morning. I blame you. You had the car.
You're welcome.
Yeah, but,
Tim Hortons.
Shout out. But no, this was truly a special guest. It was somebody that, we didn't know, but, took the risk, came onto the podcast, and we learned so much from him. And again, we can find him at www.chrisfrueh.com for more from the subject matter expert themselves. Again, you said just 2 bros trying to figure out how we're applying things to our life, but also, I don't have a PhD. Do you?
Nope, sure don't. Okay. Sure don't.
You're dressed like you might have one. If we're just saying, again, if you're still watching, thanks. Really setting your buddy up for success today.
That's right.
I didn't know it was a look good, feel good kind of day.
That's right.
Thanks, Chris.
And listen, we really are barely scratching the surface of this episode. He goes so deep. There's so much good content in his episode. So if you haven't subscribed yet here on YouTube or Spotify, Apple, however you are getting our show, be sure to do that. Hit like, hit subscribe, keep sharing the message. If you're listening to this debrief and you haven't heard directly from Dr. Chris Frueh, go back to the previous episode, listen to that one with him. He goes really, really deep on a lot of these concepts. And as always, you guys know where to find us on all the socials. And in the meantime, we'll see you on the path.
See you on the path.